World leaders at the just concluded 75th World Health Assembly have called for an improved model for funding as well as better vaccination programs around the world. Today on Sound Health, this is our focus. I am Olasunbo Modupe. Good evening. Thanks for always staying with Lagos Television. The conversation begins after this break. Please stay tuned.
The past few years have opened our eyes. We've seen pain, suffering, and untold demise. Watched forests burn, air poisoned, and waters polluted. Had a sickness that left populations diluted.
The pandemic underscored the centrality of health. It laid bare inequities and widened gaps in wealth. We learned that health is not solely for social security, rather symbiotically linked to economic prosperity.
Because of COVID-19, the world is off track. At this rate, we are bound to fall further back. So let's stop and step away from our stagnation. Take a different route to a better destination.
We propose a new path to goals of sustainability, one that supports countries' healthcare durability.
Shifting paradigm towards promoting well-being and health and preventing disease through caring for oneself.
One that reorients health systems towards primary care, making universal health coverage undeniably fair.
World leaders at the just concluded 75th World Health Assembly have called for an improved model for funding as well as better vaccination programs around the world. Today on Sound Health, this is our focus. I am Olasunbo Modupe. Good evening. Thanks for always staying with Lagos Television. The conversation begins after this break. Please stay tuned. It is still Sound Health on Lagos Television. Joining us this afternoon to share his perspective on this topic is Ayo Adebusoye, Chairman, Public Health Sustainable Advocacy Initiative. Good afternoon, Ayo.
Pleasure to be here.
Okay, world leaders just concluded at the World Health Assembly, the 75th World Health Assembly, on the need to improve better funding as well as vaccination programs as well as other key issues. Can you please let us know, can you give us a brief overview of the agenda at the just concluded meeting?
Well, as you know, we're talking of health for peace and peace for health. That was the basic theme of the 75th World Health Assembly that the globe where we have very, very low rates of vaccination. But thankfully, we also had it itself. And which was discussed is the triple billion. Next year, it was a 5-year program. 2 billion targets, 1 billion without financial risk, 1 billion more people better protected from health emergencies like pandemics. These are agenda. health coverage. Nigeria alone, with 200 million benefiting from universal health coverage without financial risk, that would make a big difference in those targets. So it's very, very pertinent, the agenda of the World Health Assembly and the World Health Organization for Africa and Nigeria especially, for us to be able to push and align with that agenda. Getting more people, 1 billion people benefiting from universal health coverage, 1 billion people protected from health emergencies like pandemics. Now we heard of the monkeypox coming up. We've got Lassa fever, Ebola is still bringing up its head from time to time. And of course, 1 billion more people enjoying better health and well-being. Well-being includes having better, cleaner water. In Nigeria, we have very low coverage of potable water. Even in Lagos State, with very low coverage of potable water, many people resort to various alternative means of getting water. Stunting, child stunting, is still very high in Nigeria. Right? Child malnutrition, very, very high. Just heard reports that we have millions of children who are facing malnutrition, especially now that the war in Ukraine, there's even less wheat going out for bread. So a lot of African countries are going to face more food insecurity as we go forward. So these are the things that we have to really avert and begin to address it with possible solutions at this time.
All right, still on an improved funding. Now, one of the recommendations by the committee is to increase access to membership dues, to ensure that many world leaders are still committed to membership dues so that we can have a better budgeting. How do you think this can be achieved?
Well, basically it means commitment. At that level, we're looking at high-level commitments from the policymakers at the highest level. Once we prioritize something, then we'll follow with it. I mean, again, look at the example of the war in Ukraine. How many billions America has committed? $40 billion to the war because they prioritized it. And so countries, once they can see that the priority, health must no longer be looked at as an expenditure. It must be looked at as an investment. That is the mentality has to grow across the board. And we've seen in Africa, for instance, despite our bigger declaration of having 15%, of our budget to be health focused, we've been very far. In Nigeria, federal government budget is about 4 or 5%, around that. So prioritization is the key at the highest level of policy. Once we prioritize health, then the issue of funding it, paying our membership dues, etc., will become secondary. Let us prioritize health. And we saw during the pandemic how everything had to close down except the health sector. And this shows the overriding importance of funding the health sector. And the World Bank has actually found out in their decades of experience dealing with very developing economies that countries that funded health, they saw afterwards a corresponding increase in economic growth. On the Asian side, has now begun to see, opposed to the old system of infrastructural investment, health and education. These are areas that have to be funded. Then we'll see corresponding economic growth across the board.
Okay, another highlight at the just concluded World Health Assembly was vaccination, how to achieve better outcomes. Only about 18% of the African continent has been vaccinated, and the disparity is wide, no doubt about that, if you're to compare that with the high income countries. Now, how do you think this disadvantage can be, overcome now?
One of the things that we have to is owned by us, our healthcare. We must stop this dependence on expecting handouts for our health. We must own our health. And thankfully, we saw in South Africa that they had a lot of the vaccines, COVID vaccines are out there, which the people who will die is even a problem. So prioritization of the health, that's why those triple billion targets are important, because they are linked. To prepare for health emergencies, one of the things that came out strong with the COVID is that those who had health issues, underlying health issues, were more susceptible to actually, coming down, getting seriously sick. The healthcare system is heavy funded. We must stop depending on development partners. Though our vaccinations, if we must have them, ensure that we produce them. The goals are there. We have the top in our fields. Nigeria has them all over the world, in diaspora and in Nigeria. Get them together. Once you realize their priority, let the private sector drive it. Government security is the first environment that must be in place.
Okay.
Travel by road from Kaduna to Abuja, nobody will come. So let us prioritize developing our own system, equipment, personnel. We have to own it. That's key.
Okay, Ayo Adebusoye, now let's look at the intellectual waiver, the patent and all that. Do you think we need much more than that, or do you also think that we need discounted fees?
That is a step, yes. That's a step in the right direction. We must be able to produce the vaccines and all that. However, all those will not better health outcomes, the ability to be able to prevent and also to treat when these epidemics come out. Because, as we just said, there are different pandemics, different diseases coming up by the day. So let us look at a situation where we begin to invest more in our own R&D, research and development, in-house. This way, for them to waive their intellectual property rights, why not?
Okay, the World Health...
Us prioritize it, yeah.
Okay, are you through with your thoughts?
Yes.
Okay, the World Health Organization Director General just got re-elected for another term now. What are your expectations? Do you have any lineup of agenda for him to look into during this new tenure?
Now it's for him to follow through on the triple billion target you mentioned, because that's supposed to expire. A lot of things got in the way. It's a 5-year program, from 2019, where we expect 1 billion more people to. Once terrorists, it takes care of all the others. Using the WHO, we need to especially get adequate data for development, which these contribute and enter these triple billion targets, having more from health emergencies and protecting them, and of course detecting when it comes out, when there's outbreaks. To collectively, get it together. In Africa, especially as a continent, Africa, Ethiopia, in fact, should be able to know where the shoe fits, the pinches that we really need. Research and development, so that we can actually develop our own health preparedness ourselves, homegrown here. Figuring out new level. So we have the resources. Let us a body to ensure that happens, so that we can achieve these triple billion targets. Have 1 billion more people enjoying better to do it. And okay. Thank you.
Let's look at his performance during his last tenure now. I know the pandemic did not actually let him achieve so much in terms of his mission for World Health Organization and improved healthcare systems around the world. Do you think it can make up for that during this era without pandemic? Because we can't just predict if there will be another pandemic or disease outbreak.
Well, it's a little bit mixed. People raised with regards to the WHO's response. We raised with regards to the WHO's response, the allegations, strong links, or with China, and that's why he couldn't calm down so much with them, because maybe they're supporting. They have China's profile was increasing within the WHO, so they still need to be resolved because it's still not fully clear with regards to the origins of COVID. It's still not 100%. It's one of get there. How did it originate fully? Was it from the animal markets? How exactly did it spread so quickly? Why was there the initial denial or suppression? COVID had actually been it was now escalated by the WHO. Some of those things need to be looked for the next time, because we saw how we are so connected now globally, and we cannot afford to think that it cannot happen again. It may not be another 100 years. It will be less, because we are now more connected than ever before, and we are also disturbing the environment more than ever before. And that's why a lot of these diseases are all zoonotic, coming from the animal kingdom. He needs to try and do a deep dive, clear out any doubts. Let us have an objective investigation into the origins of.
Ayo Adebusoye, let's look at the health tax policy recently introduced by the federal government. I know you're an advocate of improved healthcare systems and all that. What are your thoughts about this development?
I think one of the things we need, on just government existing funding. We must the health tax, where those produce products that are very high risk for health should be taxed. Alcohol should be taxed, and with the National Health Insurance Authority Act should be there. They need to look at how these health tax, not just now, should start happening now, because there's no way place where they be effective if there was already the funding now from crude oil is less. A lot of our crude oil is in store. The only way we can get, one of the things that was increasing even during COVID was alcohol sales of alcohol. People are, drinking like anything in this country, and we know what causes diabetes, liver sclerosis, so many things. And it must begin to, and in a seamless way. But the telecoms tax would be to get funding for our health sector, because it is very, very, it's seamless. And calling, the money comes in. And you don't have to chase anyone because it's automatic. And nobody shows you because it's just deducted from source. And it is a calculator that you can get over 300 billion every year on health through that tax alone. So I think this is something government needs to push, and we still need to look at how we can get the telecoms tax directly. 1 crore per second is not more. Thank you.
Okay, will this policy impact the health insurance schemes and other health options that are available?
Absolutely. That's pay for it. There are different things. People in Nigeria, 70% thereabouts. How many people can afford? You even think it's small. For instance, or 8,005 for. But how many people are paying for it? You know, about 70% of people are on the poverty line in Lagos State, and we've got about 20 something, 20. Who groups fund in the national now, the newly established law act. We need some funding to come in to support the vulnerable, which are the majority. Otherwise, we haven't got that. The premium. Those who cannot afford it, there must be some subsidy from government, and that subsidy has to come from somewhere. So we are a lot of people, but the more people use, for instance, I come back to the telecoms, as people. This is one easy, seamless way that can go directly to fund our health sector. Insurance for health service, the hospital health workers, somebody must pay for it, and that's where this health fund can come in, and why the health tax is key. You cannot wait for government funding. How much compared to what is needed? So I think we need to work very fast with the new act to ensure that the health tax is in place. And even with the basic healthcare provision fund, how slow the whole process has been. There's a lot of red tape, and how much is it even on it? It's one of the lowest countries, GDP to tax. So where is the money coming from? And so this is one of the areas that we can.
Ayo Adebusoye, Chairman, Public Health Sustainable Advocacy Initiative. Thank you so much for your thoughts on this topic. We really appreciate you.
Thank you. I appreciate it. Thank you very much.
Thank you so much. This is where we say thank you on this segment. Trending health news is up next. Please stay tuned. All right, that's it on Sound Health today on Lagos Television. Whatever you do, report symptoms early enough to the nearest health center around you. Prevention, they say, is better than cure. Join me again next week for another edition. I am Olasumbo Mudupe. Stay safe always.